meeting you all. And I am personally very proud of all of you and eager to listen to all of your success stories, as I mentioned.
We are very closely following up with all of you. And we're also following up with our long-term partnership with media societies. The presidents of these societies and University of Nairobi, of course, all are here. So we are very happy to meet you and meet our partners and to emphasize our long-term commitment to Kenya healthcare capacity building and transformation of patient care landscape in the country. We provided 1,570 and more scholarships for doctors from 52 countries in 42 critical and underserved specialties. Out of these scholarships, there is 165 scholarships provided to doctors from Kenya. This is a huge success. We worked with African First Ladies, more than 24 African First Ladies over the past 6 years, worked as our ambassador for Merck Foundation more than a mother. And this is great work because they also worked with us to raise awareness about this. And we have also started since 5 years now the Media Recognition Awards, Song Recognition Award, and also Music and Fashion Recognition Award. We have with us many winners from Kenya in Media Recognition Award over the past 5 years. We believe very much in critical role that art and media plays to be the voice of the voiceless, to break the silence about many critical, sensitive topics and issues that people sometimes feel stigmatized to talk about. We encourage them, raise awareness, we separate myths from fictions and fact. And I would like to invite you all to follow our Africa by Merck Foundation TV program, which address all these topics, which started in next 25th of May. Every Saturday, 5 p.m. and Thursday, 6:30 a.m. It's 15 episodes, very informative, very also entertaining, and it will actually engage our youth and our communities in a vibrant and entertaining way to know more about these topics, which is very important for us. We have also, as you see, the animation movie. It's very important for you because this animation movie, it's only 4 minutes length, but it's about sugar free. It's about raising awareness about diabetes that can educate children, young people, and even adults in a very entertaining way how to prevent diabetes and how to diagnose diabetes. It's very important. But not only that, we have also amazing one about hypertension, which is called Mark's Pressure, also animation movie. And we have several other animation films about supporting girls' education, like Rescue Jacqueline and Ride into the Future. Thank you very much.
I'm very happy to be here again, a country very close to my heart, after meeting you all last in 2022. I'm personally excited to be here today with you to follow up our long-term partnership with the Kenyan medical societies and academia and underscore our continuous support to contribute to transforming patient care landscape in Kenya. Our aim is to improve the overall health and well-being of people by building healthcare capacity across Africa, Asia, and other developing countries. So we are strongly committed and on our way to transforming patient care landscape through our scholarship programs. A sweeping shortage of medical and healthcare manpower is a crucial limiting factor. As per the WHO 2017 report, just 168 medical schools are in the entire African continent. In some countries, just 1 medical school. In 24 countries, only 1. And no medical school in 11 countries. Therefore, together with our local partners, Merck Foundation continues their efforts in transforming patient care landscape through our Merck Foundation scholarship programs. Dear partners and alumni, last but not least, I and my colleagues are glad to meet you today here and to hear from you all, your feedback, which is very important to us and to all of you, your success stories and experience gained from these training and educational programs.
We really appreciate the system that the Merck Foundation has done. We have been in class for the last 3 years. We started our studies during the COVID time. We did our postgraduate diploma in diabetes, endocrinology, and then the master's in science in diabetes. And all funded the Merck Foundation. And we really appreciate, without you, we would not have been here where we are.
It was a privilege to go through the course and to score excellently in each and every one of the modules. I was equally grateful for the opportunity to upgrade that postgraduate diploma to a Master of Science in Sexual and Reproductive Medicine.
When I first applied for the diabetes course, I was working in a mission hospital, Chogoria Mission Hospital. It was extremely busy and it was COVID time, and we were experiencing a surge in diabetes cases. So the knowledge I received at that point really helped me tremendously to take care of these patients and further increased my interest in endocrinology.
So the course has equipped me to have comprehensive understanding about the intricate workings of the endocrine system. It has allowed me to diagnose and treat complex hormonal disorders. Even as I run my physician clinic, I'm more confident, and this has even translated just beyond my current practice.
We had the opportunity to see a 25-year-old young girl who had presented with what appeared to be features of liver disease. We eventually were able to identify her as a case of likely what we call autoimmune hepatitis and cascade care for her. And we've been able to educate and gradually encourage her to seek care for it. She came in what looked like chronic liver disease, so we've even started discussions about transplant thereafter for her. So with the knowledge acquired from the program in Merck, I was able now to understand and probably easily cascade this knowledge to such a young patient.
We know that in Kenya, most of the fertility treatment is offered in Nairobi, so we are trying to diversify and at least bring the services closer to the people.
Since I finished the PGD, we've been able to incorporate infertility clinic services in our hospital systems. We've been able to partner with other providers in providing the care, the much needed care. There's much more that can be done.
And this impact, I must tell you, is unique, and no other pharma or even the Gates Foundations and have reached this level of impact in a country or a continent at the level of service.
The impact of this program is huge, and now we are looking at probably a pool of around 25 board-certified endocrinologists from a number of around, I think probably 8, maybe just 10 years ago. So it's a huge, huge impact for a country of 55 million people who can now benefit with improved care in the field of diabetes and endocrinology.
So we are grateful to Merck Foundation that you have helped us to train as many clinicians as possible. We don't have many training schools, especially at a specialized level for cardiovascular medicine, but the great work you're doing will really help us to really complement those few training schools that are there. And I'm happy that these great individuals are not just doing clinical work, they're also getting involved in research and other activities.